name is Marisol Valle, and today I will be doing a Witkoff scenario assessment. Hi, my name is Marisol Valle, and I'm going to be your health assessment provider today. Can you tell me your name and date of birth?
Yes, my name is Justice Douglas. My date of birth is 6/11/1997.
Okay, I already verified that with you. So tell me, Justice, what brings you in today?
I had a wet cough for about the past month now.
Okay. And with this, I have already collected his past medical history and subjective data in regards to this wet cough. And I will now continue doing a physical assessment to collect objective data. Prior to this, just a backstory, we have already collected vital signs. His blood pressure was within range. His heart rate was a little elevated at 108, respirations at 25, and his temperature was at 100.5 Fahrenheit. His height and weight were already obtained as well. To begin, I will start with a head, ear, eyes, nose, and throat assessment. Is it okay if we start that?
Yes.
Okay. I've already completed hand hygiene, and can you please take your head off?
Yes.
I will start by inspecting your head. I don't see any protrusions or any trauma. Is that correct? No trauma
Yes.
or anything? Is it okay if I go ahead and palpate your head?
Yes.
Okay. And you'll let me know if you have any tenderness or pain.
Correct.
Okay. All right. And I am just moving through the hair, observing to make sure there is no lesions, masses, protrusions, and any tenderness, Mr.
No.
Douglas?
No.
All right. So a normal cephalic head, scalp is within range and without any tenderness. I will then start assessing cranial nerve number 7, which is the facial nerve. And by this, I'll ask you to close your eyes really tight. Okay, you can go ahead and open them. And if you go ahead and smile for me, looking for symmetry, and frown for me, and then puff your cheeks out. Okay, cranial nerve number 7 is intact. Then I'll be checking for his temporal arteries, and these are located right here, and there are a 2+. Okay, that is within range. Next, I will be testing for cranial nerve number 5, and with this is to test the mastication. I'm going to ask you to clench your teeth really tight for me, and I'm going to be feeling the muscles at the jaw. Clench really tight your jaw. Okay. And then I felt the temporal muscle. It was in place. No tenderness?
No.
No. Perfect. And I will then also ask you to open your mouth against my hand. Oh, it's in place. Are you okay?
Okay.
All right. And next I will be checking for the temporomandibular joint. I'll put both hands on the side of my face, and I'm going to ask you to open and close. Okay, so there's no grating or clicking noises made when that is completed. Next, I will be palpating for your sinuses to observe for any tenderness. So this is located in the frontal. So let me know if you have any tenderness or pain to this area. That's right here. Pain?
No.
And then the maxillary pain?
No.
Perfect. So sinuses are non-tender. Next, I will be then inspecting the eyes. First, I'll start off by just looking. You do not wear any glasses, correct?
No.
Lenses? Perfect. Eyelids are without any swelling. The sclera is white. I'll be checking your conjunctiva. It's nice and pink. There is no drainage observed in this patient. I will be then checking for cranial nerves number 3, 4, and 6, and this is the ocular motor, the trochlear, and the abducens. By doing that, I will be using my pen light, and then I will be first checking for involuntary shaking of the eye. I'm going to ask you to follow my pen light, and this to check the 6 cardinal fields of gaze. Okay, so go ahead and follow my pen light. Okay, cranial nerve number 3 is intact. Next, I will just be checking for reaction to this light. Normally, pupils are ranging between 2 to 3, and his look like they are a 3. And then I will just be going into the sides with the light, seeing for any, just look straight ahead, and they did dilate. And I will be going again for constricting. Perfect. Okay, so they are reactive to light. And next I'll be checking for accommodation. So I'm going to ask you to stare at this object. I'll be going in and follow the object in and just seeing for constriction. Follow in, follow in. Perfect. Okay, cranials number 3, 4, and 6 are intact. Next, I will be inspecting the ears. So I don't see any discharge discoloration on both ears. I will then palpate. Any tenderness?
No.
No masses. I will then also be checking the mastoid behind the ear, and it's a protrusion in the back. Any tenderness or pain while I'm palpating this area, sir?
No.
Okay. So that is in place. No tenderness. I will then be using my otoscope. This will be my otoscope to be checking the tympanic membranes. What I will be looking for is a pearly gray translucent area. And in the cone of light, the right ear would be at 5 o'clock and the left ear would be at 7 o'clock. So tympanic, to look into the tympanic membrane, I will be holding the pin up back and then up. Okay. Back and then up. And there is no occlusions. If everything looks good, nice translucent pearly gray tympanic membrane. I will then be checking cranial nerve number 8, which is the vestibulocochlear. This is also known as the whisper test. By doing this there, I'm going to ask you to go ahead and cover your left ear, and I will be whispering something, and let me know what you hear, okay?
Okay. Bananas.
That's correct. Go ahead and cover the other ear, and
Dog.
perfect. So cranial nerve number 8 is intact. Next, I will be inspecting the nose. So from what I gathered in the subjective data is that you were having some clear drainage from your nose.
Yes.
Upon inspecting, nose looks symmetrical. There is no deviation of the septum. I do see some discharge, but there is no redness to the outer area. I will then be inspecting the inside of his nose. I don't see any masses or lesions or any visible obstructions. To further assess, I'm going to make sure for patency, I'm going to ask for you to hold one side of your nose and breathe in and out. Let's do the other. So everything looks fine. There is no obstruction and no redness, no hemorrhaging. Next, I will be testing for cranial nerve number 1, which is the olfactory nerve. I will be then asking to close your eyes, and you let me know what you smell. All right. With one hand, let me know what you smell.
Berries.
Okay. And then this one.
Berries.
Okay. And cranial nerve number 1 is intact. Next, I will be inspecting his mouth. So from what I see, there is no discoloration to his lips. They are intact. I will then further be inspecting your mouth. If you can go ahead and open your mouth. Okay, what I'm seeing is that he has no visible dental caries or erosions in his teeth. His teeth are intact. They look normal. I will be using my tongue depressor, and I will be shifting side to side your tongue, looking for masses or lesions. And then I did notice that through your subjective data information intake that you do use nicotine pouches.
Yes.
I will be assessing the inside of your mouth. Is that okay?
Yes.
As far as your gum line goes?
Yes.
Okay. I have gloves on. I will be then looking on his lips. Everything looks fine. There is no discoloration or masses in his gum line. I will then also be checking for visible protrusions or lesions again, and then to check for cranial number 12, which is the hypoglossal, is lifting your tongue up and down. Okay. I will also then be looking for the soft and hard palate in his mouth towards the back. Soft and hard palate, it's intact. I do notice that his pharynx is swollen. It's a little bit red. He did complain of a cough, so that area I did notice. If you can stick your tongue out for me, tonsils are visible. They are swollen and red. I will grade them a 2 out of a 4. Are you feeling any tenderness to that area, sir? To your tonsils?
Yes.
Okay. And he did endorse that. They are enlarged. I also want to check for his uvula. So his uvula is in place, and I just want to make sure it is midline from what I saw. And I will be checking for the glossopharyngeal. By this, I will ask for you to say "ah" once I stick my tongue depressor down. Stick your tongue out for me. And his uvula did raise when he said "ah." So cranial nerve number 9 is intact. To test cranial nerve number 10, the vagus nerve, I will be testing his gag reflex. So I'm just going to induce a little gag reflex. I'm not going to go too far. And it's a gag reflexes in its patent. Next, I will be inspecting his neck. So by this, colors within range. I don't see any goiters or masses protruding from his neck. I'm just gonna ask for you to look up just a little bit, chin lift. Trachea is midline. Is it okay if I palpate your neck?
Yes.
All right, any tenderness?
Yes.
Okay. So he does endorse some tenderness to the neck. That was also given to me prior. Next, I will be testing for cranial nerve number 11, and this is to assess the accessory nerve. I'm going to ask you to go ahead and look side to side. Any pain or tenderness while you're doing that activity, sir?
No.
Up and down. And then shrug your shoulders for me. And you are able to complete that without any difficulty, correct?
Yes.
Perfect. And so that completes the head, your eyes, nose, neck, and throat assessment. I will then be assessing for his lymph nodes. So by doing this, there are a few. I will be starting, you will let me know if you have some tenderness and pain, okay? There's a few areas where I will be touching, and you just let me know, okay? So I've got preauricular, postauricular, parietal, tonsillary, superficial cervical, submandibular, submental. You got posterior cervical, and then subclavicular. Any tenderness to those areas, sir?
No.
No. Okay, so lymph nodes are not tender to those areas. Next, I will be assessing his respiratory system. Is it okay if you take your shirt off for me, sir?
Yes.
During this assessment? I will start by inspecting your chest. He did come in with some labored breathing at this moment. He is using a little bit of his accessory muscles, but nothing to be concerned. He did have an increased respiration rate of 25. Right now, I would say that he is about 20 with it, which is normal. I also want to make sure that he does not have a barrel chest, which is very common with COPD. That is not the case with you. It's very good. I also will then start by palpating your chest. You let me know if you feel any pain or discomfort, okay?
Okay.
Lean forward. Any tenderness, sir?
No.
Okay. He does not endorse any tenderness to any of those areas. Next, I will be percussing. Well, I will auscultate first, okay?
Okay.
All right. Just take some deep breaths in for me, sir. Deep breath. And this is the upper lobes. All right. Lower lobes. All right, moving forward, sir. Can you turn sideways for me?
Yes.
Okay. With this assessment, I did hear crackles bilaterally, more pronounced on the right side. I did hear diminished breath sounds to the right lower quadrant. Normal breath sounds that we want to hear are vesicular breath sounds. That's to be expected. But in this case, I did hear some crackles and diminished breath sounds to the right lower quadrant. Next, I will be percussing your chest. Is that okay?
Yeah.
Okay. So I will start here. Move forward. Okay. I did notice some dullness over the right lower quadrant upon completing percussion. Next, I will be going to the cardiovascular system. Again, I am observing for any swelling or any clubbing or cyanosis to any of his extremities or any parts of his body, and he's absent for that. There is no swelling to the ankles, feet, or upper extremities. I will then start by palpating your peripheral pulses, and by that I will be checking here. They are present, equal bilaterally, they are not bounding. I will then start by auscultating your heart sounds, and then for point of reference, I will do the aortic, pulmonic, tricuspid, and mitral. The aortic valve is found substernal to the right second intercostal space, and that is where you would hear the S1 and S2. So and then I will be listening pulmonic, tricuspid, mitral. Upon auscultation, there are no gallops or murmurs. I did notice that his apical heart rate was at 108. It's still elevated as previous assessing him. S1 and S2 heart sounds were present again. So that completes the cardiovascular system. Next, I will be going to your GI system. From observing, I am inspecting. There is no stoma. It looks soft. He is not using his abdominal muscles when breathing at this moment. There is no protrusions or masses. Next, I will then be auscultating your bowel sounds. And do you have normal bowel movements?
Yes.
Okay. I'm going to be listening all 4 quadrants. Okay, and bowel sounds are present in all 4 quadrants. Then I will be palpating. There's 2 levels of palpation. Light palpation, it's 2 centimeters deep, and deep palpation is 4 centimeters deep. Is it okay if I palpate you?
Yes.
Okay. Light palpation. No masses are felt. Any tenderness?
No.
Okay, then I will be doing deep palpation. Is that okay?
Yes.
Deep palpation. Okay. No masses felt, no tenderness endorsed. Perfect. That does conclude the GI system. Next, I will be just overall observing his skin. His skin is dry and intact. Hair is dispersed throughout the body. There is no patches. If his hairs of his legs were absent, it would signify peripheral vascular disease. That is not the case in this patient. And then I will continue assessing to make sure his pulses are present bilaterally, and they are. Next, I will just be looking at his musculoskeletal system. Throughout the assessment, I have been observing that there is no limited range of motion when asked to complete certain tasks, but I will continue to assess for your strength and sensory motor skills. Is that okay?
Yes.
Okay. So again, there is no joint swelling. There is no limited movement. If you can just move your hands. Okay. Your arms towards you. I don't feel any resistance or any pain, sir?
No.
Nope. And then the same with his legs. Can you bend? Any pain?
No.
And then point towards me. Any pain while you do that?
No.
And then outward, your heel out. Okay. And then here. Any pain, sir?
No.
Okay. Perfect. All right. And then I will also be just checking for a drift. I'm going to ask you for you to stick your hands out and have your eyes closed and keep them up for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. And so there was no drift, meaning that one arm did not veer off top or bottom, and that's would be present for neurological deficits such as stroke. So that's not present. That's good. Next, I'll be checking for sensory. I'm going to ask you to close your eyes and tell me where you feel me touching you. Okay?
Okay. The left arm. The right arm. My right hand. Left hand.
Perfect. And that was good. I will next check for your strength. I'm going to just go against me, lift up, push up. Perfect. Push down. Perfect. And the same thing with your legs. Push up and push down. Perfect. And so this completes the musculoskeletal system. And just to do a quick review of his general urinal, is there any issues while you pee?
No.
What is any foul smell urine?
No.
No? So everything is fine with that?
Yes.
There's no discharge?
No.
Okay, perfect. So that is covered. There is no issues. Everything within that system is within normal limits. And that does complete my physical head-to-toe assessment on this 26-year-old male complaining of a wet cough for 1 month. My official diagnosis for him would be pneumonia. Thank you. Do you have any other questions for me, sir?
No.